Have you been thinking about doing a facelift, but you're not sure what type to get? Hi, I'm Dr. Dominic at Elite Facial Plastic Surgery, and today I'm going to cover some topics pertaining to a facelift. What is a facelift? So a facelift is meant to improve the appearance of the laxity that has developed along one's jawline, as well as improving some portions of the neck contour. A facelift is meant to improve the tissues that sit in front of the ear and below the jaw area here. It's meant to tighten up the deeper tissues so that way the skin laxity that's present can be removed and the incision is closed in such a fashion that's inconspicuous. So today, when we talk about facelifts, we're really talking about making incisions that are going to start typically up in this area here, and depending on a male or female, that incision may be varied. But for the most part, it starts in this area, it follows the contour of the ear, and then it goes around the ear, behind the ear, into the hairline. Now, with the incision, it can go in front or behind this cartilage called the tragus. However, that just has to do with designing the incision. And again, that also depends if you're dealing with a male or a female, and everybody's anatomy is a little bit different. But that incision is characteristic of a facelift. So what types of facelifts are there? Now, the different types of facelifts are normally going to be what's called a SMAS facelift, where you're elevating the skin and then you're going to be tightening the SMAS muscle below. And the SMAS just refers to a structure that blends in with a muscle called the platysma that starts around the jaw and goes in the neck. And when you tighten up that structure, what you're looking to do is really improve the contour between the jaw and the neck area, and you will get a little bit of a hole in the lower part of the neck as well. But you're really trying to make this look more youthful. Now, the next level up from a SMAS facelift to what's called a deep plane. And in that situation, you're going below the SMAS, okay? You're going to lower deeper, and what you're trying to do is elevate farther into the facial anatomy to get more of a pull. And typically, the deep plane facelift is meant to really rejuvenate the jowl area and some portions of the lower mid-face. And you'll also get some correction in the neck area as well. The difference between the two is really going to depend upon the size and the degree of aging that you're showing. Typically, patients who are 55, 60 years of age and older may be better candidates for doing the deep plane approach, whereas patients who are younger may just need a SMAS type approach. Now, there's also been a nomenclature of a, quote, mini facelift. And really what that refers to is just how long the incision is. I've had patients who are in their late 40s, early 50s who just really want to get a little bit of correction on the jawline. And in that situation, you don't necessarily need to bring the incision all the way up into this area and in behind the ear and into the hairline. But again, the mini term really is just referring to the location of the incision and then what you're trying to pull. Now, you've probably also heard of what's called a mid facelift, where you're kind of working in this area here. And then part of doing these facelift procedures is also sometimes having to address the neck area. In my practice, when I reference a, quote, neck lift, I'm really trying to get these platysmal bands or muscle fibers that go from your clavicle up into the face, and I'm trying to address that laxity that's present there. Now, you can get some improvement in that when you do get a facelift. However, if you have heavy banding, that's where you have to make a separate incision underneath the chin, and that allows you to get exposure to the muscles, and sometimes you need to trim those muscles and tighten them back up to provide better support to this submental area. Now, this brings me to those patients who've already had a facelift and they want to get further correction. Let's say it's been several years since your last procedure and you're showing signs of aging in the face and neck area. And in that situation, we would do what's called a revision facelift. Again, it aims to the same thing as doing either a SMAS or a deep plane. You can certainly do a revision facelift in those situations, and a revision neck lift for that matter. The revision nomenclature just refers to the fact you've already had a facelift in the past. So this brings me to my part of the video where I ask the question, what's the best facelift for you? And to be honest, that's something that's going to be very difficult to, give a clear-cut answer on a video, because every patient is different. And what this has to do with is patient's age, ethnicity, whether they have a history of having smoked in the past, whether they've had weight loss, skin texture, as well as changes that have occurred to the skin. So there are so many variables that are out there, and that's where having a discussion with your surgeon so that way they can assess you, look at the things that are bothering you, and then give you the best recommendations as to what can be done to correct what is on your mind.